Assalamu alaikum everyone, welcome back to Dr. Hafsa's Obstetrics and Gynecology study channel. Today I am going to talk about sickle cell disease. Sickle cell disease can both be homozygous and heterozygous. It is mostly present in the blacks in the Middle East countries and in the Indian Oceans. That is in both Pakistan and India this disease is present. So in the homozygous both genes are defective, and in heterozygous one of the genes is defective. The maternal risks of this disease: in the mother it can cause infection, vaso-occlusive sickling crisis, it can cause acute chest syndrome, it can cause renal compromise and jaundice, and the mothers who are carrier, they are not at risk of sickling crisis. Then what are the risks to the fetus of this disease? There is a possible risk of inheriting this disease in the fetus, and fetal growth restriction can also occur because the sickle cells, they are not able to carry oxygen properly, and so the fetus does not get proper oxygen, and thus fetal growth restriction can occur in the fetus. What are the tests which can be done to diagnose this disease? The tests like that of isolactic focusing and HPLC, which I talked in the previous video as well. This is high performance liquid chromatography, and this is isolactic focusing. These two tests can be done to diagnose sickle cell disease. Then invasive testing can be done in those fetuses, that is chorionic villus sampling can be done in those fetuses in which we suspect that the fetus may suffer from sickle cell disease. Either the mother is heterozygous, or maybe both mother and parent they are heterozygous, and we suspect that the baby and the fetus may have sickle cell disease. So we can go for invasive testing like that of chorionic villus sampling. And another thing is that the affected fetus with the sickle cell disease is usually not anemic at the time of the birth, because there is hemoglobin F mostly present in the fetus, which does not sickle and provides oxygen to the baby. But after 5 to 6 months or so, when hemoglobin F is completely replaced by the adult hemoglobin, then anemia starts appearing in the fetus. Follow my channel for more information.